Sherekea Kenya, matibabu kwa wote. Sherekea juhudi muhimu kuimarisha afya bora Kenya.
Health is a key priority for His Excellency President Uhuru Kenyatta. And that is why in his second term, under the Big Four agenda, he put up the pillar of universal health care. Now, what you and I know is that accessing health facilities in the country was such a big pain, especially for the local mwananchi. And other than the fact that the facilities were scarce, the price was also quite expensive. So in order to ensure that every person and every citizen is able to access health, good and quality health, the first thing His Excellency did was to ensure that hospitals or other health centers were built in various sections and areas of the country in conjunction with the county governments. In 2013, we had 4,440 hospitals or health facilities. And now we currently have 6,350 health facilities. That is an increase of roughly 1,950 health centers. That means that now health has come closer to the people. This is so especially for the people living in the informal settlements. Why do I say so? Currently, 29 facilities have been put up in the informal settlement areas. That's a sigh of relief for them, a ray of hope that they can now access good healthcare facilities and experienced doctors, and at a minimal price. The other thing that was a painstake was ICU facilities and ICU bed occupancies. Now, we had 108 beds, ICU beds, in 2013. Now, we have 651 beds for ICU. Do the math on the difference. This is because His Excellency needed to ensure that every Kenyan can access every sector of the hospitals. And these ICU beds are not only a preserve of the elite, but can also be found down in the county governments. The other thing that needed to happen was to ensure that facilities or equipment were also available in order to make the facilities workable and the facilities made sense. Now, dialysis is one of the services that is accessed by many Kenyans. And that used to be a preserve of the few. You either needed to come to a facility where there'd be long queues before one would get their dialysis treatment, or they had to travel long distances in order to access this facility. From 26 machines in 2013, we now have 577 dialysis machines countrywide. To make matters better, this price has also been subsidized. Why? Because of NHIF. NHIF now enables one to be able to go through dialysis at a minimal price or at no cost at all. Another facility that ensures that the local mwananchi is able to get adequate facilities and good health facilities was to ensure that all other facilities like MRI, CT scans, X-ray machines were also present in all these facilities. And that was made possible by His Excellency partnering with the county governments as well as international organizations. Child mortality was a big issue, mostly because most of the women opted to give birth at home as they could not cater for the expense of being in hospital. His Excellency President Uhuru Kenyatta partnered with Her Excellency the First Lady, and together they worked to see how they can be able to bring down the mortality rate. The Linda Mama project, or the Linda Mama facility, was brought to birth, as well as the Beyond Zero program. This is to ensure that women were able to access maternity at a closer place near them through the Beyond Zero mobile clinics, as well as ensure that they were able to come to the hospital at no cost through the Linda Mama facility. All this being made possible. And now, oh my, over 5.9 million mothers have been able to deliver their children. 5.9 million mothers have been able to deliver their children in health facilities, ensuring that they get the top class access and service. Another thorny issue that was facing the health sector and the country at large was cancer. Now, one of the things that His Excellency was able to do in conjunction with the county governments is to ensure that health centers were built or health centers were set up in different hospitals and in different facilities around the country. And this continues to be done. This has ensured that the cancer patients are able to access facilities and are able to access services or treatment at a subsidized price. Many of these facilities are still ongoing in terms of construction, and soon they will be where the people are. This has also been made possible because of His Excellency's efforts in partnering with different organizations, even internationally, like the Manchester University and the Christie Foundation, that have become a key partner in the health sector to ensure that Kenyans are able to access high-quality health care at a cheaper rate and closer to them. The NHIF fund is also something that has also come in handy in ensuring that patients are able to access health facilities at a subsidized price. Currently, the registration stands at 10 million and the beneficiaries stand at 23 million. This has enabled these particular patients, or you as a Kenyan, to access facilities in the over 120 facilities that can be able to carry out services of MRI, CT scan, X-ray, and many others. The other disease that has really affected the country is malaria. His Excellency was the chair of the ALMA organization, an organization under the African Union that deals with combating malaria. The malaria prevalence levels have gone down significantly from 8% to 5.6%, and not only in the country but also globally. After all is said and done, increased facilities, better health services, as well as programs that ensure that the local mwananchi is able to get health care closer to home or closer to where they are and at a cheaper price absolutely means nothing if they don't have people attending to them in those facilities. And in order to fill this gap, His Excellency President Uhuru Kenyatta, under his administration, has been able to employ 37,000 healthcare providers, bringing their number to 74,000 healthcare providers nationwide. That is in public facilities. This has enabled and will continue to enable that Kenyans are able to get good healthcare at a good facility at a good price. Well, now you know.
Tunasherehekea mikakati bora kuimarisha afya Kenya, hatua kubwa katika